Treating lesions in coronary heart disease before they lead to the first symptoms, the dream of every cardiologist. At the University Hospital Düsseldorf, a novel imaging method using magnetic resonance tomography is being tested, which has yielded remarkable findings in small animal models.
In our mouse model, we are able to map the entire cascade of the vessel disease, beginning from initial inflammatory processes, going beyond to thromboplatelet attachments, development of thrombi, and finally vessel occlusion, leading to ultimately to myocardial infarction.
While normal MRI provides anatomical information based on hydrogen atom nuclei in the body, scientists use fluorine nuclei in this case.
Our approach uses the fluorine nucleus, in contrast to the normal MRI processes, which you are using the protons, which, due to the large amount of water which is present in our body, gives excellent anatomical information, and with fluorinated ligands, which are directed against specific targets, we are creating molecular information which is projected on top of the anatomical information, which allows us to identify the exact anatomical location of the molecular danger patterns. With this approach, we are able, for the first time, to visualize simultaneously at least at this moment, three different danger patterns, beginning from initial inflammatory patterns, going beyond to thrombotic processes, which lead finally to the occlusion of the vessel and at the end to the development of myocardial infarction.
From the researcher's point of view, application in humans would theoretically be directly feasible.
From a technical point of view, the approach can be easily transferred to the clinical setting, since fluorine coils can be mounted to each clinical scanner. From the pharmaceutical point of view, there have to be carried out clinical studies from phase 1 to phase 4, and which have to show the safety of the used pharmaceuticals and the contrast agents. And let's see how this will definitely take some time.
In principle, the technological basis is already there. We have the MRI equipment, which can be upgraded very easily to see the fluorine nucleus. And on the other hand, we need the contrast agent. So what we definitely need is a strong industry partner to support this contrast agent to go into the market.
For patients with cardiovascular disease and for hospital processes, this method could bring many benefits.
The utmost greatest benefit for patients is that we can visualize disease and disease progression very early. So one can suppose that we can use those techniques and this technological platform as a whole as a screening tool for atherosclerosis and for inflammatory disease on a whole. And this is what it elegantly can image, and not only because it is very specific and we can image the specific inflammatory foci, it can image beyond inflammatory foci every pattern we would like to have to image. There has to be development, aiming at having an image of anatomy and functional tissue information and properties within a few minutes. So MRI is a very attractive platform because it is very abundantly available.